Um, and our mission statement, as you see on the board there, is to prepare for, respond to, and recover from crisis using all available resources to provide patient care at the appropriate level and in the most efficient manner. And we do that through a collaboration of healthcare services, providers, disciplines throughout not only our region, but across the state into Idaho, across the border into Canada, across the border into Oregon, and across all of Washington state. So it is a huge task, and it takes all of us to be part of it, and it's greatly appreciated to see you here to help us do that. So thank you for that. Today, just a few meeting logistics. As you all know, you came in the back door. Some of you have heard this spiel before. The front door, main door, is probably the primary way out. I'm sure you're all parked out there, but if for some reason we have to evacuate the building and we can't go that way, we've got exit doors on both sides. So please easily, orderly evacuate the building, and if we could meet over in the north parking lot, that allows us to congregate, monitor our sign-in sheet, make sure that we've accounted for everybody before anybody departs. And so as part of that, please make sure when you get the opportunity that you do sign into the sign-in sheet, because we like to know that you're here. And in some cases, it provides verification that you were here if you need that, or if we need that. So and it also gives us a list to validate that we've got everybody accounted for. Endurus provides a wonderful facility for us, and food and drink are allowed in here. Just ask Adam. So if you have that, that's great. If you do have cell phones, please silence those, put them on buzzer. Let's show some appreciation for all of the speakers, all the people in the room, so that we can focus on the work at hand and move the work that we have forward. Bathroom locations, as most of you probably noticed as you walk by them, are right outside the doors here on the left and the right of the hallway. We do not schedule a break time in our agenda because we cram a lot in there in a short amount of time. So feel free to take a break if you want to. If you need to, stand in the back, use the restroom, get a drink. If you have to go out and make a phone call, that's great. Feel free to do that as you need to. We do have folks on GoTo, and we have quite a few people on GoTo, which is great. Gives us a bigger reach to a bigger audience. Which adds some logistics to our presentation. And so primarily for speakers, if you're out in GoTo land and you're on your computer, if you have a question, please type that question into the chat room. We will be monitoring the chat room, and we can pull up those questions for you, and we can relay those to the presenters. The presenters, if you see questions or take questions from the audience, it's very helpful if you repeat the question in the microphone, because the microphone is tied to the people on GoTo. So please repeat the question as part of your response so that the people at GoTo aren't left in a quandary wondering what the question was. So before we get into our agenda, just a couple announcements that we wanted to throw out there. Here's a couple training opportunities that are coming up in our region, actually very quickly. Highly infectious disease detection, prevention, and response training is taking place at Providence Sacred Heart Hospital, Children's Hospital, on June 22nd. Great conference. I understand there's already a lot of interest in the conference. My staff have argued to be able to go, and they wanted to be one of the first 25 so they could be part of the tour, and already missed out on that. But it is a great opportunity to learn about highly infectious diseases, and I'm sure there will be a lot of work at what Providence has put in place on behalf of our region, and even bigger than our region, to handle highly infectious disease conditions. So great opportunity to learn about infectious disease control and prevention. We are also having WATRAC trainings at the Deaconess Medical Office building. They have a computer lab that provides, I think, about 20 computers. So they are providing trainings for their staff as the DMCC, but they've got opportunity to allow other healthcare facilities and partners to participate in that training, to have access and knowledge and learn how to use the WATRAC tool, the advantages of the WATRAC tool, and how to take advantage of it. So that's an excellent opportunity, 2 opportunities there. And if you want to sign up for those, you can RSVP or register, access through the Spokane Regional Health District website, srhd.org/HCC. So take advantage of those if you have an interest or a desire. They are great opportunities. So here's our agenda for today. But now before I get to the agenda, I'm going to continue with my rambling of a few announcements that are taking place. One of the sad things that we have is Elena is one of our administrative support and a whole lot more for our Healthcare Coalition. She has taken another position within the Spokane Regional Health District. So we're sad to see her go. I think she will enjoy what she's doing, but it's full in that we're going to have and a gap that we're going to have. She's done a lot of great work for us on our behalf for so many different things. Patient tracking, concept of operations is one example of that, and she's done great things. So it's a hole that we're going to have. But then on the other hand, I've got some exciting news to announce, and I'll try to run through this pretty quickly. I don't know if Casey's in the room. No? Okay. We did hire regional exercise coordinator. Corey Scholey is hired on with our Healthcare Coalition. He's going to be doing coordinating regional exercise involvement, which is a great thing for us to have, especially as you look at CMS guidelines and where we're going in the future with exercises. So he's going to be a key part in that, and how we as a region and how we as a Healthcare Coalition can move forward with exercises, exercise planning, and exercise design. We also have a great opportunity that's coming to us through the Department of Health with additional funding that really helps us support an Eastern Washington role. So we're actually looking at additional positions that the Healthcare Coalition will be hiring on here in Spokane. One is a Eastern Washington regional planner. This position will be involved in exercise or regional planning on an Eastern Washington level. So they will be working with healthcare agencies, helping the regions, 7, 8, and 9, work together, healthcare partners to coordinate plans, and really move the planning activities forward on behalf of Eastern Washington. So it's a great opportunity for us because they're housed here in our Healthcare Coalition, but they will actually be coordinating on a regional Eastern Washington level, which is really exciting to see that type of collaboration take place. We're also looking at a communication specialist, an Eastern Washington communication specialist, which will be helping the Healthcare Coalition in Eastern Washington deal with communication issues, information sharing, how do we share information, how do we collect information, how do we put our plans together on an Eastern Washington level so that we can share information, credible information, and have value there. So it's another position that we're bringing on, which we're pretty excited about. The third position that we have is a Eastern Washington exercise training coordinator, which is another exciting position that we're looking at and excited to bring on to Eastern Washington coordination of exercise and training. So it's pretty exciting. I think it really helps us bring a more coordinated, collaborative approach into Eastern Washington, and it builds a great capability and capacity for us. As you know, we coordinate the healthcare system. It doesn't cross county lines, it doesn't cross regional lines, so it really goes a long way to build a more inclusive system for us. So it's exciting. Those announcements are posted on the Spokane Regional Health District webpage if you're interested. And if you're really interested, I happen to have a copy of each one of those in my folder, so see me before you leave. So we're excited about those opportunities. They are open until June 2nd, and we're really looking forward to see the quality of candidates that we can bring back to the Healthcare Coalition to help the work that we do and to help support the work that you do. So those are some exciting things that are coming up. And now we'll talk about today. You get to see me, and I'm sorry for that. I'll try to make it quick so that we can get to the real meat of the agenda. We're going to start off as usual with Gail Callis, is the Director of Patient Care Services of Rockwood Health Systems. She's our C-suite introduction for today. She's going to give us an overview of Rockwood Clinic and their oversight, their desires, their plans, their role, what they see their position is in regional healthcare planning and response capability. So we're excited to have Gail here, and not only for this presentation, but for continued work with Rockwood Health Systems. It's a great relationship. They've been a great partner, so we're excited to continue that. Then we're going to hear from Jessica Jimenez from the FBI. She is going to talk to us and give us some insights into the Orlando nightclub shooting and how that shooting impacted the healthcare system and the response systems in Orlando. So we had this slated for last meeting, so I had to push it off, and we're excited that Jessica is able to join us today. I think it's going to be a great opportunity for us to learn the lessons that they learned and help us plan and prepare on our side. Then we're going to follow that up with a more local incident. Ken Mitchell is here from Kootenai Health, who will talk about the campus shooting that they had experienced a couple months ago and really bring it home to help us understand the policies, the procedures, the planning that they have put in place. Let me rephrase that: the planning, the policies, and the procedures that they put in place as a response to that event. So another local event that really tells us that these things can happen anywhere. And so we'll learn how they responded and what impact it had on their healthcare facilities. Then we're going to hear a little bit of a report from Travis is going to fill us in about our situational awareness process that we put in place and how that worked during the flu season when we used that process to collect credible information so that we could develop and plan for resource and response needs in response to the influenza outbreak. So it's a great opportunity for us to work on a policy and procedure that we put in place. And it's a great opportunity today to hear how that went, what were the lessons learned, and where are the areas of improvement. And I think one of the areas of improvement, in case I'm sure Travis will touch on this, but credible information is only relevant if we can receive the information and we can share it. So a big part of that is your healthcare facility determining who those key contacts in your facility are that can be part of this process. So I hope I didn't steal your punchline, but I just want to make that clear. But to make that situational awareness really valuable for all of us, we need to be able to gather and disseminate that credible situational information as fast as possible, and we need your help to do that. So keep that in mind as you hear what Travis has to say. Then we're going to break from there, and we'll break up into our, as you recall, our CMS work groups. We started that process several months ago to look at the new CMS guidelines, to look at the HVA analysis process, the planning process, the policies and procedures process, and implementation. So we've kind of been working through those steps. We've been hearing and learning from each other. And again, today we're going to take advantage of that to take that next step and really talk about policies and procedures and how that has impacted us. And as part of that, it's not on here, I don't think. We'll get to it later, but I think we'll have John from Rockwood is going to walk us through what they have learned from their event, the active shooter that took place at Rockwood 2 years ago, if I remember right. Notice I didn't exactly give a month, but somewhere around 2 years ago, they had an exposure that he's going to talk about the lessons that they learned, how they took advantage of those lessons, and put policies and procedures in place. And it's really a great process that mirrors kind of the thing that we're looking at here and trying to help you with as you work with SCMS activity. So with that, we'll go ahead and jump into our agenda. And Travis is going to set up Gail, but I'd like to introduce to you Gail Callis with Rockwood Health Systems.